Idaho Matters is brought to you in part by St. Luke's Pharmacy, now offering free home delivery. For daily medications or one-time prescriptions, home delivery is easy to set up. It's convenient and safe. St. Luke's Pharmacy, now delivering to your doorstep. Information on how to get started at stlukesonline.org.
So you can't see this, but hopefully you can hear it. Behind every Boise State Public Radio podcast is a team working hard to bring you stories that matter. So if you value podcasts like this one, please support them. Hit donate at boisestatepublicradio.org. Thanks.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. You're listening to Idaho Matters. Here in Idaho, a state that now has some of the toughest abortion laws in the country, well, voters could soon be asked a big question about who should be making these deeply personal medical decisions. After the Supreme Court's Dobbs decision took federal abortion protections off the table, Idaho's trigger ban went into effect, and it created a near-total abortion ban with very few exceptions. And since then, the debate here in Idaho has only grown more intense, with doctors leaving the state, concerns about access to women's health care, and a new citizen-led campaign that says it wants to put the question directly to voters. That campaign, the Reproductive Freedom and Privacy Act, has now gathered enough signatures to qualify for the 2026 November ballot, setting up what could become one of the most closely watched political fights in Idaho in years. Joining us now to talk more about this is Melanie Falwell. She is the executive director of Idahoans United for Women and Families, the organization that's been leading this effort. Melanie, it's nice to have you on the show. Thanks so much for making time for us.
Thanks so much for having me.
So, Melanie, for listeners who have maybe only heard or seen headlines, what exactly is the Reproductive Freedom and Privacy Act, and what would it change in Idaho if passed into law?
That's a great question. So, the Reproductive Freedom and Privacy Act is a citizens' ballot initiative. Here in Idaho, we have a constitutionally protected right to, when our legislators won't make a law that we believe needs to be written and passed, we can write and pass it ourselves. This law would essentially restore us to the standard of reproductive freedom, medical privacy, and legal abortion access that we had in Idaho for nearly 5 decades, nearly 50 years. It would end the current ban, and it would ensure that we have protections in cases of risk to the health of the mother. Right now in Idaho, we're one of only 5 states in the nation that does not have a health exception. But we did for a really long time. We can get back to that standard, and we can ensure that we can protect access, and we can make sure that doctors aren't criminalized for providing care, and we can do things like protect birth control, Plan B, and IVF at the same time.
So, Melanie, Idaho, as you and I both know, is one of the most conservative states in the nation. What made your group believe that voters here in Idaho were not just ready for this conversation, but that they would want to vote in favor of basically, as you said, bringing back the rights that women used to have in Idaho?
You know, we started this thing with the hypothesis, with the hunch that on the whole, Idahoans would not like the severity of this ban. People don't usually like their rights being stripped away. So we began with that idea that actually this isn't a partisan issue, despite very strong efforts from a whole lot of lobbyists and special interests and politicians to make it partisan. Our hypothesis was this is actually a kitchen table issue. This is an everyone issue. Everyone needs to see a doctor when they get sick. Everyone needs health care. And everyone, I believe, likes to believe that tough decisions get made at their kitchen table about their own family without politicians or the government having a seat at that table. And so we sort of discovered very rapidly on the all the places we went on this campaign, the 60,000 doors we knocked, the hundreds of thousands of conversations we had, that that hunch was correct. And we saw that the people signing the petition, expressing great enthusiasm for wanting to see this on the ballot, were people of all kinds of partisanship.
So you've pointed to the loss of OBGYNs as well as shrinking maternal care access since the sugar ban went into effect here in Idaho. So Melanie, what have you heard directly from doctors and families across the state as you have been knocking on those doors?
One of the things we were struck with pretty quickly, and it only worsened over the 10 months of the signature gathering, were how many people had been personally impacted by this ban. It was physicians and healthcare providers, healthcare workers themselves. It was people related to them. It was people who were a patient or love a patient or had some sort of ill effect of this ban. We see this ever widening circle. And we started to say on the campaign that no matter how you feel about Idaho's ban and abortion access, this ban comes for you all the same in ways that you might not expect. You might not care about OBGYNs, but someone you love does. Or you might need to see a family physician or a pediatrician or an emergency doc or a specialist. And right now, we haven't just lost OBGYNs. We are dead last in the nation in doctors of all specialties.
So, Melanie, for Idahoans who personally oppose abortion, but are uncomfortable with government involvement, especially when we're talking about these really private, personal medical decisions, what has been your message to these particular Idahoans?
I mean, it's a message that we heard from them. It was kind of an exchange of idea. It's something we've seen in our research. It's something we've seen in independent polling. And it boils down to this idea of no matter how we personally feel about abortion access, we ought not impose those beliefs on others. And at the end of the day, yes, complex personal decisions about pregnancy, reproductive health, and yes, abortion should stay between women, their families, their doctors, without government overreach. There is no medical decision that has benefited from interference from people like lawyers, politicians, attorneys general. So that is an issue message that resonates across all partisanships. And we saw that in our signers. I mean, only about 37% of people who signed our petition were registered as Democrats. The majority of folks were either unaffiliated or Republican.
Well, with that said, Melanie, I mean, your very own numbers suggest exactly that, as you said, that this support extends beyond just Democrats. And we're talking Republicans, unaffiliated voters, right? Independents, as you said. In your mind, in your opinion, and what you've been seeing in Idaho as you've traversed the state, is this becoming less of a partisan issue for a regular Idahoan? I'm not talking about our politicians, and more of a personal liberty issue.
I think absolutely. I mean, the way the ban was passed in the first place is because it couldn't become law. It couldn't impact anybody's life. It couldn't impact anybody's health care they were receiving or conversations in the exam room. But after the fall of Roe, after the Dobbs decision, I think that all changed. The landscape changed. And now these things that were theoretical, that were kind of playing political football with ideas of people's personal lives became very, very visceral, literally. And people were navigating some of the, hardest days of their life, saddest, most difficult, now being made scarier, more dangerous, more expensive, because now you're out of network, prolonged, and quite harrowing because of interference from the government. And in our experience, Idahoans fundamentally chafe at that intrusion.
I want to talk next about the initiative itself, because one of the most discussed pieces of this initiative is legal abortion up to fetal viability. So we're talking generally around 24 weeks. Why was that standard chosen?
It's a quite common standard across most states, and including the states where you've seen initiatives on ending their own abortion bans. It's meaningful from a medical perspective, and that is a clear line in a pregnancy when a fetus is able to survive outside the mother's body. It has meaning to people. They can understand it. And it is the Roe standard that we lived under in Idaho for a very long time. So it's not something new. It's not a radical reimagining of abortion access. It is the bare minimum standard for stabilizing our care, for stabilizing our expectation of personal liberty and human dignity. And we believe, and we've seen in polling, a standard that Idahoans can, in majority, agree on.
And after viability, abortion under this proposal would be limited to physical medical emergencies. Why was it important that your organization include that as well?
I mean, again, that was the standard we had, and that is the cause of so much of the really profound heartbreak we've been seeing in the state. Again, we have no exception for health of the mother. We have no exception for fatal fetal diagnosis, which forces women to carry doomed pregnancies, risking their own life and health. Not to mention just what a horrible, gruesome thing that is to do to a person. So it was absolutely critical that we make sure that medical emergencies, which is, yes, the life and health of the mother, and when something goes horribly wrong in a pregnancy, that those all be included in this reform.
So another thing that people may not be aware of is that the initiative also includes protections for contraception, emergency contraception. And you've mentioned this as well in our conversation, but also fertility treatments like IVF. I am curious to know why you decided to make this broader than abortion alone, and put these protections in place as well within this initiative.
That's a great question. So, we've gotten that a lot. Like, hey, these little list of things you've mentioned, they're perfectly legal right now in Idaho. Why include them? Well, we were looking at this through the lens of reproductive health, which is a complex set of things related to contraception, pregnancy, and that includes access to birth control, access to things like Plan B, and yes, access to IVF. And many of these things are all related to one another. We would have loved to have left out those things, but unfortunately, they are currently under attack here in Idaho and nationally by the same people who brought us this ban. They are people who are completely out of step with the average American and average Idahoan about things like birth control and IVF, and they want to constantly encroach on access to those things as well. So we included them as a way of ensuring that we were defending the entirety of a person and a patient and their right to access their own reproductive health care.
In the last couple of minutes I have with you, Melanie, I do want to talk about the opposition to this initiative, because there are opponents that say this proposal goes too far. In your opinion, what are they misunderstanding about what this initiative would actually do?
I will say this, for the opponents who are spending money, including out-of-state organizations who are spending dark money into the state to text propaganda about the initiative, they intend to confuse and scare and frighten people. And the tactic that they've used state after state where this has been on the ballot, it's the same playbook. They say the same things. And no matter what the policy is, they say it goes too far. Because the reality is they are supporters of a total abortion ban nationwide. And they know that most people don't support that. So they will say and do anything to keep the ban in place and to keep their political win on the board. And I really think that's a shame, because this isn't about scoring points and building political power. This is about people's lives.
Before I let you go, Melanie, if voters remember just one thing when they see this measure on the ballot come November, because you gathered those signatures, it should be on the ballot come November, what do you want it to be?
I would want people to remember that we have an Idaho problem. We wrote an Idaho solution, and everyday volunteer Idahoans, their fellow citizens, went out and hustled hard for 10 long months, getting signatures from their fellow Idahoans. We raised money from Idahoans and have been completely transparent from top to bottom about what's in this initiative. You can read the language online. You can ask us any questions. You can hear from experts. Know that this is, at the end of the day, a restoration of the rights we had for 50 years and a path forward for making sure that Idaho is a place where you can start a family, grow a family, live your life, knowing that your most private, personal medical decisions get made with your family, not with the government.
Melanie, I want to thank you for taking time to talk with us today. We've been speaking with Melanie Falwell. She is Executive Director of Idahoans United for Women and Families. We have been talking about the initiative that we'll see on the ballot come November, restoring abortion access in the state of Idaho. The initiative is called the Reproductive Freedom and Privacy Act. And thanks so much for listening to Idaho Matters from Boise State Public Radio. Do you have thoughts about today's episode? Make sure you email us at idahomatters@boisestate.edu or reach out on our socials. And you can also listen to Boise State Public Radio podcasts, including Idaho Matters, on YouTube. Hi, Idaho Matters podcast listeners. If you're on your smartphone right now, or if you have it nearby, I wanted to pop in to tell you about something to check out. Boise State Public Radio is now on Nextdoor. Here's what that means. Trusted local news, thoughtful reporting, and stories from across Idaho right along your neighborhood updates. If you already have the Nextdoor app, you're halfway there. Just search Boise State Public Radio and hit follow.